as they focus on that massive COVID-19 drive to test as many South Africans as possible. Anchor presenter Desiree Chauke joins me in the studio. Yes, you can understand. So much to talk about, Desiree, and so little time. And in fact, as I'm reading that, I'm thinking there's so much information coming in, including the resources that are available. The WHO just had a press briefing on how they're continuing to learn, not only about the testing, the screening, and what the results mean. Yeah. So that was my brain working.
Whenever you try to wrap your head around the numbers that are coming out globally, you also want to have the local picture of what's happening. And the big story in South Africa, well, one of the big stories is the low mortality rate, which is something South Africa and the government has been praised for so far in terms of the handling of the outbreak. But our focus today, the testing, how it's rolling out. We've seen today different premiers throughout the country going out to ensure that it does take place, those mobile testing units manned by the 10,000 field workers. And we're taking a look at, we're talking to a professor in vaccinology at Wits, who will tell us, he has been quoted in an article where he says the total number of people testing positive for the deadly coronavirus in South Africa is an underestimate of the burden of COVID-19. So we want to unpack what he means.
And this is also what the WHO was addressing earlier on, the fact that there are people who are asymptomatic, and the question was whether or not they can also infect those. One of the things they did emphasize, it can still happen through droplets, which is what we're discussing here on The Full View. The healthcare workers and the lack of protective gear.
And that's one of the topics.
Thank you so much for joining us, Desiree Chauke. Do join her on Unfiltered 8:30 this evening here on SABC News.